name is Mayra Vasquez. I am a UConn MPH alum. Currently, I am a research consultant for my study called Produce for Life. It's a collaboration with the American Heart Association, with Yale and Hispanic Health Council. In all reality, I had no clue what public health was. It was just one of those things where I kind of had to do more research to kind of figure out what that was. I knew since I was in high school that I really wanted to give back to my community. I really wanted a job where I could help people. And all along, I knew I wanted to do something in healthcare or make people healthy. And when I discovered what public health was during my junior year, it just really enticed me to continue doing more research, figuring out what that looked like, what careers are possible, and so forth. And so my junior year, I discovered there was a 4+1 program at my university, and that kind of led to my public health track.
Mayra served as a peer supporter for Produce for Health, a pilot produce prescription program, which is a collaboration with Hartford Hospital, Yale School of Public Health, and Hudson Way. Her role is very important because she works closely with clients with type 2 diabetes and helps them to use their incentives to prepare and buy fresh produce. She also helps them to overcome or support them overcoming some of the barriers to accessing healthy foods. She refers clients to other resources as well in the community. She coordinates the nutrition lessons that they take within our program, and also providing one-on-one support to each of them so they can engage more in the program, but also in helping them in redeeming their incentives.
Sí, ojalá que a más gente le interesan así quiero hacer un poco de conexiones para ver si puedo hacer un proyecto así más. UConn MPH program really was one of those things I picked up while I was doing my research. Once I realized a 4+1 program was possible, especially given that I was still in business school at the time, it really helped me to know that I was able to apply with any major, and then that would also contribute to, what public health is, what I can do in public health as a career, and so forth. And once I applied for the 4+1 program, it just made things more easier, faster, I want to say cost efficient too. And it really led me to where I am today.
So Mayra's role contributes to public health because she works really closely with the participants in this program. So she very much has to build trust with them, rapport, and really make sure that she can talk to them and see hey, are your needs being met within the program? Is there anything else I can help you with? Is there any referrals? And really making sure that she can be able to follow through. Here's this resource. Here, I can contact you with this person, A, B, C, and D. So very much a lot of the times I feel people they're struggling. They're oh, I'm having issues with housing. I'm having A, B, or C issues, but I don't have the support. I don't know where to find this resource. So being able to have Mayra as that support system, and for them to be able to be hey, I actually have this person in my corner who can help me, I think it's huge. So she has a really big impact in public health, and we're very grateful for her.
I think the UConn MPH program really prepared me for this role because it opened up my eyes to what these disparities look like and how they can intersect within the community. It's really opened my eyes, and so I'm not coming into this role surprised that these things are happening, or surprised that people who are facing other healthcare issues are also experiencing housing issues, just general welfare issues and so forth. So the problems I'm trying to solve really are around food insecurity, any barriers to getting fresh produce. It could also be around the topics of social determinants of health. It really depends on what my clients need, but because of what the program is, we do touch upon food insecurity a lot. For my current job, I use a data platform. It's called Way to Health. And I know that's not like something we use like mainstream, like public health wise, but knowing how to control and how to basically use a data platform and input data and add or change anything like that, that really will contribute to your success of, you know, picking up programs, using them, and so forth. Piece of advice I would give MPH students is kind of what I've learned in business school as well. It's just to network, because you never know if the professors in the room, the peers you make in your class, the TAs that are helping you never know what those connections are going to lead to, if it's like a career or just a collaboration in the future, or if you just simply want to talk to them about what they're doing in their career, like afterwards, like after graduation and so forth. You never know really where these connections are going to take you. So take advantage, build up your network, talk to your peers, talk to your TAs, talk to your professors, because it's only going to advance your career in the future. UConn overall, they have a lot of studies, a lot of faculty work on their own research, and really being able to be a part as like a student, now a graduate, an alumni, it really like intrigues me and makes me get to know people a little more. Like if I see somebody that says like UConn alum or works at UConn and so forth, like I always make it a question like, oh, have you ever worked with so-and-so? Especially like when it ties back to like my major advisor, Dr. B, she knows a lot of people in this community. She even knows my boss currently. So it all comes back to UConn, really.